Welcome back to the Woven Well podcast. Have you ever thought about working with a midwife? Most who hear this question would assume that I'm talking about midwifery care for pregnancy or labor and delivery, those sort of things. But did you actually know that midwives are prepared to provide services throughout your entire reproductive life? That's exactly what we're going to talk about today. So, even if you're not pregnant or trying to be, this episode is for you. I've invited experienced midwife Hamilton Yarbrough to talk about the role of a midwife and how she can play an important role outside of pregnancy. And honestly, I can't wait for it. I think it's going to be really interesting, and I'm excited to hear what she has to say. So, Hamilton, welcome to the show.
Hey, thanks for having me.
I'm so glad that you're here, and I'm so interested in this. This began, I'm not exactly sure when, but a while back, I saw a post on Instagram that your office listed that was talking about, hey, we have other gynecological services. I was like, people never think about that. So I'm excited to talk about that with you, but I'd love to start by learning just a little bit about you and your work as a midwife. How did you get where you are today?
Yeah, absolutely. And yes, GYN care is one of my favorite things to do and to have just the relationship that starts a lot of times before pregnancy and also like getting to see women as they like evolve and age and mature and I don't know, it's really beautiful. So I'm so glad to be here to talk more about it. And all the things. My background started in the hospital setting. So I actually worked at a local hospital called Simon Williamson Clinic, and I was a midwife there for about 2 years and was, of course, catching babies, but about 75% of our practice was gynecological care. And that ranged from somebody who just started their period and was coming in to be like, whoa, like, what's my cycle? What's happening here? What are all these things going on in my body? All the way to people who've gone through menopause and, hormone replacement therapy, all the different things, all the natural methods to support your body. And so that's been, I've had a pendulum swing some from that since when I started, but it gave me a really good breadth of just really appreciating working in gynecological care and and loving that. And then I had my almost, he's 6.5 now, but 6.5 year old at home in 2019. And I had always wanted to work in the community setting. So work in like birth center, home birth. And we had some visions, ideas when I was at my hospital practice of like making a midwife led birth center. But after I experienced the really like intentional in-depth care of just community midwifery. And for listeners who may not know what exactly that is, it's like in the hospital, we were allotted 10 to 15 minute slots to see a client. And when I'm making care as I want it to be, we get an hour with you.
Yeah.
Honestly, sometimes we're stretching that, but I get an hour with you and get to have as much time as we need to really delve into what you're feeling in your body and your mind and your soul and like how all the things are impacting you and your lifestyle, not just, hey, okay, here are these like preventative tests that are due for you. How are you doing mentally? But that's kind of where I started. Went and did home birth, experienced home birth. I've had home birth for both of my kiddos, and I just like immediately became sold. Like I knew from some short experiences in my clinicals in nursing school and in midwifery school that I thought I wanted to do out of hospital work. But until I like full body experienced it, that's when I just was like, I have to move into this realm. And so I did. And that's what I've been doing ever since. And so I am on call for catching babies and then also doing clinic. And I have my office over Family Wellness Chiropractic off Valleydale Road in Birmingham. And we just, I love it. The space is
Amazing.
very just like different than the traditional setting.
Yeah, and I want to hear about that too because um, I love that you started in a hospital setting and then you have transitioned to be outside of hospital because, like you said, you got experience in both of those. And I'm sure you saw just such a wide range of women. And that's fantastic to get that kind of experience. And so, obviously, I think a lot of people are familiar with midwives helping in labor and delivery. But it's funny. I was telling this to you before we started recording. Like, of course, in in history, midwives were care throughout a woman's reproductive life, and then now we think of it just for pregnancy and delivery, but it expands. It goes so much beyond that.
Yeah.
So I'd like to hear a little bit of what that looks like. I mean, you already hinted at it, that it starts, with first period and goes all the way through menopause, but maybe we could talk about that a little bit. Like, what are the gynecological services that your clinic would offer?
Yeah, absolutely. So a lot of what I do is preventative care, preconception visits, annual or biannual preventative visits for wellness. And then, yeah, it just ranges completely. I honestly love when parents send them in just to like chat about their cycles and like be like, okay, yes, this is my like 13 to 16-year-old who's like really wanting to know about this. Or sometimes like they have some symptom that they're like, what is this? Is this normal? And like their parents are like, I don't know. I want to,
Yeah.
you know?
Yeah.
And so then it like kind of starts a journey. So it's like, and of course, like the typical things too of like, oh, like I have a yeast infection. What do I do? And sometimes it's just something as simple as that like starts the journey and starts the preventative health journey too of like, okay, well, how are we supporting your body's energy? What is your lifestyle like? And let's just be real, most teenagers are not, I wasn't either, living like to their best energetic potential and all the things because they're out there, eating fast food, having fun with their friends, which is also wonderful and great for their
Hmm.
community. But yeah, so kind of just like shedding some light of like, okay, this is what it looks like when you're like making choices on your own. This is what your body can feel like. These are the different like phases and cycles. And like you have this beautiful part of your body that you get to learn about and appreciate for this whole long season of your life. So that happens also too a lot of times when people are 30. It's not just when they're 16,
So true.
So, but that is what we can do. And then also, of course, like just generally talking about your health and like what impacts you and mental health, physical health. You may can hint it from that, but I'm very much about like how is our body functioning? Are you getting outside? Are you getting sunlight? How that is going to impact you hormonally? Are you touching the earth? Are you touching the water? Whatever it is, and also like at the end of the day, within all of that, I'm such a like, we are all individual human beings. And so one thing that may work like perfectly well for me may not work perfectly well for you. So here are like the things to try. And that may be like a big difference from like traditional care. I'm going to put the ball back in your court and I'm going to say, I want you to go experiment with all of these things and figure out what works for you. And then we can come back and we can troubleshoot. We can check lab parameters and like see how things are improving or things like that. But yeah, so the short answer is there are all kinds of wellness things that I do that can range from mainly preventative care. And then also people will come to me with, hey, my periods are irregular. What's going on? Can we troubleshoot them? Or I've like had heavy bleeding and cramping. Like, what can we do with that? Or I think I might have a UTI or a yeast infection or any of those kind of like basic ailments that people may experience from time to time that are signals from our body, right? Of like what's going on. And so, yeah, so just troubleshooting all of that and, also have a wide range of clients. I would say most of my clients are looking for a more holistic approach versus like, hey, just give me the traditional meds or whatever. But, finding the avenue for that as well if needed.
Absolutely. And I really appreciate that everything that you've just said is all positive based. How can we celebrate this? How can we learn more? This is a good part of, your body, and it's something that you're going to be living with for the next however many decades. And so how can we care for it, nurture it? I think that's a fantastic approach. And there sounds like there's a lot of permission in your practice to just come in for whatever your question may be,
Mm-hmm.
whatever you're dealing with, whatever your curiosity is, and you can get support there. It sounds like you have a wide range of approaches that you have to each one of those. So if they did come in with an issue, you mentioned painful periods or yeast infection, or, I mean, you listed lots of things, but would your approach automatically be different than the type of treatment that would be recommended at a hospital OBGYN? Or what's your take on that?
I guess it depends on who you're seeing.
Okay, fair.
But probably, yeah. So generally speaking, they're probably going to just be like, "Oh, here's some diflucan if you have a yeast infection or whatever." Whereas I'm going to be like, "Okay, like there are all these different parameters that we can go over. Do you want to talk about what's going on in your gut biome and your reproductive health, and like, what are your hygiene practices? Let's take some time to delve into those, or whatever. Maybe we could consider the supplement, or different
Yeah.
things that are going to kind of help. And then I'm probably going to be recommending that you do like coconut oil versus or other just different like alternative methods, and giving you some options for that versus doing that right off the bat, so that we can preserve some of that microbiome health. But I also totally have people who like are like, no, this is miserable, I want to just like figure out how to get it gone right now, and then
Sure.
we'll like work on the stuff after. So again, it's just like where you are in your body and your season, like what feels right to you, um, is kind of like the approach that I take to it.
Yeah, that's great. Everyone is going to need slightly different care. And so your flexibility and being able to provide that for them is very helpful and is a very dignified approach. So I think that's great. You mentioned earlier like getting lab work done to check for something or that sort of thing. Talk a little bit about that. Like how often would a patient also or client also need to get services from a hospital or another clinic, or I'm thinking mammograms or ultrasounds or lab work? Like how does that typically work if you go to a midwife clinic for all of your gynecological care? Do you also have to go to those others?
So you don't necessarily have to go like into an office that, a different office to see another provider, but I do not have like, if you wanted to do a DEXA scan or mammogram or things like that in office, we do have ultrasound twice a month, but there's also local imaging centers that I can send folks to if they need pelvic ultrasound or things like that, because twice a month is great for OB clients usually, but it's not as convenient for our GYN folks. There's plenty of options for places to refer for GYN ultrasound. So we will do that. Labs are in house, and I have, funnily enough, I have a lot of GYN clients that are like, I have needle trauma or phobias from like different places, and like will only come see me to do their blood draws. And they're like, I don't care if we have to wait. I don't care if I have to pay you $50. Like, I don't care. Like, you're drawing my blood. And I think that, I don't know, it's fair to a certain extent, because you're not sitting there with I mean, it's fair to all extents, but with your arm like on a plastic chair
Yeah.
and like somebody under like bright lights, it's like, oh, it's cozy. And if you want to smell essential oils, you can smell essential oils and like lay down and on the chase, and we're going to draw your blood. So it feels just less stressful, I think, to the nervous system in general. But all that to say, the blood draw is available in the office. LabCorp is the main lab that we use, just because Blue Cross Blue Shield is partnered with them. And so um, we draw it, send it off, and it just kind of depends on what we're following up with. So if it's somebody who is checking in on annual labs, needs to look at a history family wise or something, and wants to do that for cholesterol, or it may need to be done once a year or more frequently depending on what's going on, or every 2 years, or all of those things. But the same thing, we're going to have kind of custom recommendations based off of your mammogram, your pap, like all those things based off of your like history. And then there's kind of standard guidelines as well for those things. And then if you're looking for like, preconception, wanting to make sure your hormones are on track or whatever, that may be like a one-time situation. If it's like, yeah, they look perfect. Or it may be like, hey, let's check them again in 3 months after you've like done some different hormonal support work, and come back and see where they are.
Yeah.
So it kind of just, it varies from person to person, but yeah, whatever they need.
Well, and I just want to acknowledge too, you talking about the comfy environment. You can smell essential oils. You can lay down if you want to, no bright lights. How different is that from the standard experience? I mean, pretty significantly. So even though you mentioned it very quickly, I just want to acknowledge that that's a fantastic alternative, just to have a place, a space that feels so much more comfortable. I know that means a lot. Now, you mentioned Blue Cross Blue Shield. I know we're kind of wrapping up, but in general, does that mean that you accept insurance?
I wish. They will not let me be in network with, yeah, doing home birth, and it's a whole rabbit hole. I've considered something like that, but at this time I'm out of network. And I will say one of the benefits of being out of network is it really can be like whatever you need it to be. It
Yeah.
doesn't have to be like, I have to file for these certain codes for you to be able to get reimbursed. And most of the time we can submit a reimbursement and you get some back. But it's, I had somebody come one time, I guess this happened more than one time, but where, she just needed to talk about, I mean, I think we spent 45 minutes of the hour just talking about like postpartum fears and like what had come up and like all the different things that she was processing, thinking about maybe moving into the pregnancy zone again. And that's valid, right? And if
Yeah.
that's what somebody needs, I'm obviously not a therapist, but I think it's also really important for your provider to like be able to witness and hear all of those things before you move into that space that feels really vulnerable again.
Mm.
And so I will say that's like kind of the nice spot about not taking insurance is that really and truly like the visit can be for whatever you need. If you've had GYN trauma in the past and you need to sit there for 40 minutes and us just chat and you maybe say like, actually today isn't the day, I'm going to come back in a month and try again. Or I want to do it myself, you know, self-collecting
Mhm.
your pap, you go for it.
Mhm.
And so I think that that's a really nice part that I do appreciate about it.
Absolutely. And I do think there is more and more healthcare that's going outside of the insurance model. So you are certainly not the only one there. Well, I appreciate you taking the time to share all of these things. I know you have a very busy practice, which we celebrate. That's fantastic that you do. And so thanks for taking the time and being on with us today.
Of course, it was great to chat with you.
Listeners, I hope this has been helpful. I realize that Hamilton is in the Birmingham, Alabama area. So if you are outside of that area, then you may be thinking, well, this is not super helpful. But it is helpful because you may have a midwife in your area that can specifically help you outside of pregnancy and postpartum, your entire reproductive life. They can provide great care and counsel. So you can look into options that are local to you. And if you are in the Birmingham area, then I'll make sure to have her information in the show notes. If this episode was helpful, would you help us in return? Just take 5 seconds to leave a quick review. I cannot overemphasize what an impact this makes in allowing our podcast to be available to others. And if you're a Woven client or want to be a Woven client, then we're actually going to send you a thank you. So just let us know. As always, thanks for listening as we continue to explore together what it means to be woven well.